Hey Marion, my name's Ashley. I'm one of the nurse practitioners at Center Street Community Health Center. Today I want to talk to you about the difference between actual flu and having cold symptoms. Flu can come on suddenly, rapid fever, body aches, chills, headache, cough. Those are all pretty good indicators that you might be actually infected with the influenza virus. A cold can be nasal congestion, a mild cough, a little scratchy throat, maybe a low-grade fever, but usually doesn't exceed 100 Fahrenheit. The times to seek out medical care are if you have a fever that's not responding to medications such as Tylenol or Motrin, not able to drink fluids. Those are all times that you want to go see the doctor. There are medications available to help shorten an influenza virus, but those aren't always indicated, and sometimes the best treatment for it is staying home, using good hand hygiene, covering that cough, fluid, rest. Whenever you are diagnosed with the flu, let's say you do come into a doctor's office, urgent care or such, and you say, yes, you do have flu A, flu B. Those are the two most common we test for. The illness can last for anywhere up to 7 days. I've seen cough linger as long as 2 weeks even. You are able to infect others those first 3 or 4 days of the illness typically. So again, I stress staying home, resting, lots of fluids, washing your hands, covering your cough, to do everything you can to prevent the illness. Also, every year I do recommend getting your flu vaccine. This helps to prevent flu infection and can decrease the risk of spreading flu to the ones that you love, especially elderly and pregnant women, little ones. Whenever you have a cold, you're more likely to start experiencing maybe a slight cough or nasal congestion or drainage dripping down your throat. But then, you may wake up and you feel okay. And then by the end of the day, you kind of feel a little scratchy or a little feverish. Those, again, are usually indicators that it is, in fact, a cold, okay, which is a virus, not unlike the flu, which is also a virus, but that one tends to come on very suddenly, high fever, significant cough, headache. So there are ways to tell the difference. So again, the differences between flu and a common cold. Our flu would likely have body aches, high fever, sudden onset, headache, sore throat. If it's a cold, you may wake up just a little congested, sore throat, maybe a low-grade fever, but likely not, and kind of improves or gets worse as the day goes on. Biggest things are hand hygiene, lots of fluids. If you do find yourself feeling feverish or symptomatic or just not sure, you're not feeling well, feel free to come over and see us over at Center Street, and we'll do our best to take care of your healthcare needs.